The installation and use of the Rebirth knife. First, manually screw the cutter head of the Rebirth knife clockwise to the transducer, and after manually tightening it, use a metal wrench to tighten it. When using a metal wrench, use your thumb and forefinger to hold the head of the wrench. Use your middle finger against the handle of the wrench and tighten it slowly and with slight force in the clockwise direction. When you slightly feel that you can't unscrew it, take off the wrench. Put on the silicone sheath. Connect the foot pedal and step on the foot pedal, and then you can use the Rebirth knife after the self-test. When operating with the Rebirth knife, you should first step on the foot pedal to activate and then contact the tissue for the operation. Attention! Do not use excessive force when tightening the metal wrench to avoid damaging the transducer. Please do not use other specifications of metal wrenches to install or disassemble the Rebirth knife by yourself in order to avoid the torque mismatch that may cause damage to the transducer screw. If the metal wrench is lost, please contact the distributor or the manufacturer. Knife-shaped Rebirth knife is divided into a blade and a back. The thinner side is the blade, and the thicker side is the back. Knife-shaped Rebirth knife is mainly used for cutting surgery through the foot pedal to stimulate. It can realize the role of coagulation while cutting during the operation. Because it works by ultrasonic mechanical energy as the source, it does not produce a lot of smoke during the cutting process, and the thermal damage to animal tissues is very small. The doctor can adjust level in the operation according to the situation of the tissue. For the less capillary muscle tissue, fat tissue can use level for rapid cutting. For capillary-rich or high coagulation requirements of the tissue, the doctor can adjust the screen to reduce the level. The lower the level, the better the coagulation effect, the slower the cutting speed. When using the knife-shaped Rebirth knife, as far as possible to keep the knife blade and the tissue to maintain vertical cutting in the cutting process, should be avoided to use the knife surface to cut the tissue or the part of the knife blade outside of the working part of the tissue cutting. Annular Rebirth knife is mainly used for the cleaning of the lesion tissue and play the role of coagulation at the same time. The doctor can adjust level in the operation according to the situation of the tissue. For the less capillary muscle tissue, fat tissue can use level for rapid cleaning. For capillary-rich or high coagulation requirements of the tissue, the doctor can adjust the screen to reduce the level. The lower the level, the better the coagulation effect, the slower the cleaning speed. Spherical Rebirth knife is mainly used for spot coagulation and surface coagulation of bleeding tissue. For spot coagulation, the blade is placed close to the tissue and held still for small-scale coagulation. For large-scale surface coagulation, the blade is moved slowly against the tissue to form a coagulation surface. For larger areas of tissue with less bleeding, the doctor can use level for rapid coagulation. And for larger amounts of bleeding, the doctor can lower the level through the screen for complete coagulation. Do not press the ultrasonic scalpel trigger button and the foot pedal switch at the same time during the procedure, so as not to cause injuries and damage to the equipment. After the procedure, press the power button on the lower left side of the generator screen to turn off the machine.